welcome you to the CHIA webinar, Interpreting for Sexual and Gender Minorities with Jorge Ungo and Tim Moriarty. And guys, I'm going to go ahead and switch this over to you.
Great. Well, thank you so much, Michelle, for the introduction. My name is Jorge Ungo, and we're excited to have this opportunity to present this content to you all. Content that you're going to find in this presentation today derives from a series of conversations that took place with the National Council on Interpreting in Healthcare at their annual membership meetings over the last few years. At the NCIHC membership meetings, there are what is called the Language Access Cafe, and it's an opportunity for stakeholders from around the industry to provide their input, ask questions, and share information about different topics. One of the topics that had been of interest year after year after year has been this very topic right here. We know that people who are gay, lesbian, bisexual, transgender, intersex, and asexual have to navigate a world where it can be difficult or dangerous to be themselves. A world where being heterosexual is quote unquote normal, and being anything other than that is by default abnormal. Add on top, there are people who have language barriers. And so we know that as people become more comfortable expressing themselves and being their genuine selves, that interpreters will be put in positions where they are interpreting either for patients, family members, or even providers who identify as LGBTQIA. So our goal is not necessarily for this to be Sexuality 101, but really more so to open your eyes as interpreters to some of the information that you need to seek out in order for you to be up to speed whenever you do face a situation like that. I always like to say it's really, really important for interpreters to be informed and to be prepared. So what we want to do today is to lay that groundwork of what is the type of information that you need to seek out in order to be informed and to be prepared. So why this topic? Again, it's been a recurring topic at the National Council on Interpreting membership meetings. But in addition to that, a lot of healthcare organizations are now developing standards of care for healthcare professionals to provide optimum healthcare to individuals from these different groups. So there's awareness being raised within the healthcare community. In addition to that, there is legislation that has been enacted to prohibit discrimination and vice versa. And so we want to make sure that that legislation isn't impacting whether or not people even want to access healthcare. And what we also know is that individuals who are lesbian, gay, bisexual, transgender, intersex, and asexual are susceptible to health disparities in the same way that individuals of ethnic minorities, individuals with language barriers are also susceptible to health disparities. And of course, there are going to be linguistic and cultural issues that you as an interpreter are faced with, and you need to make split-second decisions on how to handle those situations. So again, today we want to set the groundwork along these different topics. Tim?
Sure. So one of the other reasons it's important for us to understand why we should even as interpreters talk about LGBTQIA issues is really what's going on in the world. Some of us were born in the US, many of us may have been born in other countries and are interpreting for people, perhaps from our own country, perhaps from other countries, for people who speak the same language pair that we speak. So it's important for us to understand the serious nature of what LGBTQIA people are going through. These news sources were just from within the last 6 months about what is going on around the world and in the United States with regard to LGBTQIA people. So what do you care? Well, if you're the interpreter and you're in a room with someone who's from a country where people who are LGBTQIA are repressed, oppressed, jailed, murdered, that person is probably not going to be as open. That person may be not as well informed as he or she should about healthcare issues, and maybe entering in risky behavior that would be important for the doctor to know about, to be able to speak to that with the patient. But if you're not even aware of some of these issues, you can't alert the doctor, the nurse practitioner, the nurse, etc., to the cultural issues that are going on at home that may prevent someone from being open. And as interpreters, it's also important for us to understand language. So this was just a quick slide to understand that although in the United States, and I'm here in Massachusetts, and you guys are in California where there's lots going on and lots of knowledge about the LGBTQIA communities, and they are separate communities but under one umbrella, this is not news to you. But perhaps to think of it in a different way, not just as someone who's watching the news, but as someone who may be in a room with someone who has been beaten or who has been abused or who has been lured into a situation where they were outed to their family, lost their job, lost their ability to have income and so forth. So that's some of the reason why we think it's important to discuss this topic. And this is just a very quick selection of items in news. There's much more that continues to go on, and you'll see it if you look for it, especially outside of the U.S.
Yeah, so before we move on, we've got a self-assessment that we would like to do. And this is essentially a way for you to gauge where you are right now in your knowledge on these topics. So Michelle, do we have those poll questions ready?
You bet. I've got them right here. Here we go. Question 1, which is, I feel completely comfortable interpreting for LGBTQIA people. And we will give our attendees about a minute to choose their vote. The answer choices are completely agree, agree, somewhat agree, disagree, and completely disagree. And of course, this is one of those poll questions that has no right or wrong answers. It is simply an opportunity for everyone to gauge their own comfort level and for our presenters as well to get an idea of where you're at. So we've had about 3/4 of our attendees have voted. We've got about 50 people on the call today, which is really great. Thank you again to everybody who's attending. And as soon as we have most everyone's vote in, we'll go ahead and show those results. Okay, I don't see any more activity. It looks like everybody who has chosen to vote has done so. So I'll go ahead and close the poll, and we will put that up on the screen. So we have 22% of our attendees saying that they completely agree. 46%, which is the highest number on this particular poll, said that they agree. Another 22% somewhat agree, 7% disagree, and 2% completely disagree. So most people are in that agree range with between somewhat and completely.
And we appreciate that everyone has been really honest. The completely disagree is probably one person, and thank you for being honest, that you just don't feel like you have enough knowledge. It's great for people who agree and who really agree, who get it, are completely comfortable, but this is also really important for people who don't have the information, and that's why we're talking about this topic today. Are there any more questions, Michelle, or is that the survey that we're doing?
Oh, I'm sorry. There are more questions. You want to go ahead with the rest?
Yeah.
Apologies. Okay, you bet. Next question. My personal knowledge, beliefs, and experiences will allow me to interpret for LGBTQIA people in a fair and factual way. And again, we have the same answer choices: completely agree, agree, somewhat agree, disagree, or completely disagree. So, and this is, of course, talking about as an interpreter, your knowledge, beliefs, and experiences as an interpreter. So almost everyone has voted. We'll just wait for a couple more people to pop in. And it looks like everybody who wanted to vote has done so, so we'll go ahead and share those results. So pretty much the same situation here. We've got 26% completely disagree, 43% agree, 26% somewhat agree, 2% agree, 2% completely disagree. And as you pointed out, Tim, that's probably one person or so in the disagree and completely disagree area. And then most people in the agree range. Next one. I am able to identify and explain what the terms lesbian, gay, bisexual, transgender, queer, intersex, and asexual mean. Now that's a lot of terms, guys. So I think what you're asking is if people can feel comfortable with all of those, correct?
Correct.
So if you think that you feel comfortable identifying and explaining terms, maybe one or two of the terms, but perhaps not all of them, that may change your vote a little bit. And nearly everyone has voted here, so we'll go ahead and share these results then. All right, so slightly different spread here. We've got completely agree 12%, agree 14%, somewhat agree 40%, disagree 19%, and completely disagree 16%. So to summarize, most people are in the somewhat agree range, and then kind of evenly spread out through the rest of the categories there. We'll go ahead.
And we'll move on. I think we have one or two more questions.
3 more questions here. I understand how I can enhance or inhibit an LGBTQIA person's ability to communicate clearly and honestly. And there wasn't enough room for the rest of this question, but clearly and honestly with the healthcare provider. So basically we're talking about the healthcare team. So go ahead and post your answers there. And so let's close that up and we'll share the results. So we've got 15% completely agree, 34% agree, 37% somewhat agree, 12% disagree, and 2% completely disagree. So we've got most people in the agree and somewhat agree range there. We'll move on to the next one. I am able to discuss health challenges or inequities that have direct impact on LGBTQIA people. We've got completely agree is 12%, agree 19%, somewhat agree 38%, disagree 26%, and completely disagree 5%. So again, most people are in the somewhat agree range. And the last question, last one here. Oops, I just have to click the right buttons. I am aware of the linguistic and cultural challenges that interpreters may face with LGBTQIA children, adults, couples, and parents. And so with our last question, we've got completely agree 16%, agree 30%, somewhat agree 30%, disagree 19%, completely disagree 5%. So it's evenly split between agree and somewhat disagree, and then some other responses in there as well. All right, so back to you guys.
Thank you, Michelle. Really interesting results, and again, the intent of the poll is there to be as a self-assessment. So for you to kind of check where you are at and see which areas you may hopefully glean some new understanding after this webinar. So we appreciate everybody participating in the poll questions. So on the screen, you should see some of the broad topics that we're going to be discussing today. I want to go ahead and move on to the first one, which is going to be issues regarding language. There we go. All right, so as I said when we first started, we certainly don't want this to turn into Sexuality 101. There's just way too much content to discuss in order, to really immerse yourself in this topic. But again, we want to describe some of the areas of study that you may want to look into and give you some just surface understanding on some of these topics. So, you know, first
and you will
of all,
see, just a second, and you will see on the bottom of many of the slides, for your own study, you can go back and dive much deeper into these topics, because we've only got about 3 minutes, 4 minutes per slide to be able to go over the content. So please feel free. The links are there for you.
Absolutely. Thank you, Tim. Sexual orientation versus gender identity. It's important that at a minimum, interpreters know the difference between sexual orientation, gender identity, and gender expression. And so this is a learning tool that was developed to help trainers teach professionals around these topics. You'll notice that under gender identity, gender expression, you don't see male and female on the opposite sides of the spectrum. For a long time, we kind of thought of gender and sexuality as being, you know, male, female. But really, what we're learning is that it is much more of a spectrum. Gender identity is what one's innermost concept of themselves is, versus gender expression, which is that external appearance of one's gender identity. And gender identity does not always align with a person, with the genitals that a person was born with the chromosomes. There can be some variations there. Sexual orientation, on the other hand, is whether someone is physically attracted or emotionally attracted to one or the other, or a combination of both, or somewhere along the spectrum of different gender identities. So again, this tool is intended to be sort of a learning tool to be used. And at the bottom of the screen, you see the source from where we obtained this tool, so that you can look further into it and learn more about the differences between gender identity, gender expression, and sexual orientation.
So language is important, and we talk about some good and bad language, as it were, some preferred language later on. But this is some of the basic language that as interpreters we should be aware of. If someone were to use this term, whether it were a doctor, nurse, or the patient, him or herself, it's important for us to understand, first of all, what it is in English, and then how we would move that into the other language, or vice versa. And in some cases, these words may exist in your other language, but they may not. So then how would you express them if they're being asked of a patient in a sexual history, for instance? So some of the words that we tend to hear that people wonder about is queer. And some people feel that this word is very insulting to the gay, lesbian, bisexual, transgender community, because it was used to point out that we were different in the past. And in some places, it still is used as a negative. But like some other very powerful words in our society with regard to race and religion and so forth, queer actually for many people is being taken back, and the negative power is being taken away from it. So for some people, queer means that they fall somewhere in the LGBTQIA spectrum. It's kind of an umbrella term. Instead of having to say LGBTQIA, people may refer to the group as queer. Oh, we're having a meeting among the queer folk, you know, on Tuesday night or whatever. Some people refer to them as queer. In my bio, I talked about how I identify as a gay man, but I also identify as queer. And again, that's a power. The word doesn't have any negative power for me anymore. I don't give it that power. And I also lived in a big city. And it's not universal that everybody in a big city is more comfortable with queer, but oftentimes people who have lived in big cities hear queer much more often and are maybe more comfortable with it. But certainly not that everybody accepts that. What is questioning? Well, it is exactly what it says. If you're not sure whether you're gay or straight, and obviously that happens in the teen years for many people, but what about transgender? And if I'm intersex, and I'll get to that in a second, what does that mean, and who am I? Sexuality is part of who we are, but it's an important part of who we are. And questioning oftentimes is the first step for someone. They may decide, no, I am a straight male, I am a straight woman, I'm only interested in the opposite sex. But many people go through a stage at some point in their life where they're wondering if they may, in fact, be sexually interested, emotionally interested in someone of the same gender. Intersex, this is a term, we've already mentioned it a couple of times, and it's a term that we don't hear that often. The negative term, and we'll reference that in the future, is typically hermaphrodite. That a child was born with both male and female genitalia, although there are many conditions that fall under intersex. And in the past, surgeons, sometimes without asking the parents, but oftentimes more recently, asked the parents about what they should do because their child was born intersex. And they would oftentimes at birth determine what gender that person should have. But just because the outside looks one way doesn't mean that actually the hormones inside and so forth are going to have that result. So nowadays, it's more common for people who are born with both genders, parts of both genders, to wait. And it may be to wait until puberty or even till adulthood to decide what they're going to do. And some people choose not to have any surgery and not to make any clear decision. They're going to live their life how they were born and interact with people socially and sexually in the way that they feel comfortable. And they have to find people who are comfortable with that. So these, again, are words that it would be important for you to look for, and you can use the source at the bottom of the page to learn more about some of these words.
So legislation, whether at a federal level, a state level, or a local level, can have a positive or a negative effect on healthcare access, health disparities, and a person's willingness and again, comfort level with accessing healthcare services. There are so many categories of laws around, and again, at every level, from the federal level down to the local level, that can impact this. So starting with medical decision-making policies, a lot of healthcare and insurance laws. So there are laws that protect people from being denied health insurance coverage, but at the same time, there are laws that explicitly exclude people from being able to get certain types of healthcare coverage. Some states like Massachusetts and Minnesota have laws in place which provide trans state employees access to transgender and translated healthcare, whereas in other states, there's laws that explicitly prohibit that. Conversion therapy laws. This has been a big topic in recent years. These are laws that address whether or not licensed mental health professionals can subject people to conversion therapy practices that try to change a person's sexual orientation or gender identity. So this is based on the fact that there's something wrong with this person that needs to be fixed. And it has been found that this can be a very harmful practice. So there are laws now, we're starting to see more and more laws that explicitly ban conversion therapy. Last time I looked, there was only 5 states that do that, but we're hoping that more and more states will start to ban conversion therapy.
And conversion therapy seems like kind of an innocent discussion with the therapist, but it actually can involve things like electric shock and other really detrimental things to someone's bodily and mental health. So this is not a benign thing that people are trying to do. It has long-term negative impacts on people who undergo this type of therapy.
So with the 2015 Supreme Court ruling on marriage equality, same-sex couples now have obtained recognition for their relationships in all 50 states. A handful of states also have more comprehensive legislation, which recognizes civil unions and domestic partnerships, which, you know, when you talk about from a linguistic perspective, have a slightly different meaning than somebody being able to be married. So that was a really important landmark moment for our community. And non-discrimination laws are laws in place to protect LGBT people from being refused services or from facing discrimination. And now what we're starting to see are religious exemption laws, so RFRA laws, which are protecting people from expressing their religious rights and thereby, in essence, discriminate against people because that person's sexual orientation or gender identity does not conform with the person's religious beliefs. And so, are we protecting the LGBT person, or are we protecting the religious person, essentially?
So this sounds like, oh yeah, we should respect everyone's rights, but in fact, what it can mean is that right now, that if and the big case is kind of the wedding cake case, where someone had been going to a bakery for years and then decided they wanted to get married and wanted that bakery to do it. Bakery, not such a big deal. It's an annoyance, and it's certainly very negative for the couple that thought that they had a great relationship with the owner of this bakery. But it has historically, but also could come back to mean that if I wanted to rent something, if I wanted to use a service that your company provided, they could say, no, we don't serve gay people. We don't serve transgender people. So these laws are very dangerous.
So again, we believe that it's really important that you as an interpreter are aware of what laws affect the patient population in your geographic region. If you go to the link at the bottom of this page, which is ncihc.org/LGBTQIA, and scroll to the section that says legislation, there's some great links, including one link where you can actually click on a map and see what laws are in the geographic you serve, so that you can gain a better understanding. Because again, these laws are going to impact people. It's going to impact how willing they are to be open about things. It's going to impact whether or not they're actually seeking out healthcare services. It's going to impact, just so many things about the information that they share with their healthcare providers. So it's important for you as an interpreter to be up to date, up to speed on those laws.
So I'm not going to spend much time on this page. You do have a link where you can actually, I believe, download or get a link to the page for these guides so that you can actually look at them yourselves. But we talked about how there are health equity issues for LGBTQIA folks, and there are different issues depending on whether you're talking about gay, lesbian, bisexual, transgendered, asexual people. There are different issues that come into play. So the Joint Commission World Professional Association for Transgendered Health, Gay, Lesbian, Bisexual, and Transgendered Health Access Project, and Consortium on Disorders of Sex Development, among others, have come up with standards of care to ensure that queer folk are getting the type of care that they should be getting, and that they're not being asked questions that they don't need to be asked, and they are being asked questions that they should be asked. Next.
Yeah. Okay. So again, a lot of information that we believe would be helpful for you as an interpreter to know. You know, at the end of the day, as we said in the beginning, there are systemic and societal issues that create discrimination for individuals. I was just on vacation a couple of weeks ago, and when we checked into our room, the first thing that I saw was a card from the owner of the hotel that said, "Thank you for joining us, Mr. and Mrs. Jorge Ungo." And it was a very jarring thing. It made me almost feel unwelcome. This assumption that because we were checking into a room that had a king-size bed, that obviously we were a heterosexual couple. It is those type of societal heteronormative issues that really make people feel unwelcome in certain places. And we see that in healthcare organizations. We see that when patients are filling out forms We see that when people ask questions like, are you married? What does your wife do? And that also trickles down and impacts the person's health, right? If someone's not willing to access preventative healthcare service, or not comfortable or welcome, then that obviously is going to affect their health and well-being. So we see lower rates of health insurance coverage amongst people who are LGBTQIA. We see higher rates of violence. We see very high rates of body image issues, particularly amongst gay men and trans men and women. We also see higher rates of substance abuse and incredibly high rates of suicide. In fact, this is one statistic, just every time I read it out loud, it just makes every hair on my body stand on it. Trans teens whose families reject them have a 58% suicide rate. 58% of trans teens whose families reject them commit suicide. For those whose families support them, that suicide rate drops to 4%. That is how
Jorge, it sounds like we lost you. So I'm going to continue the slides until he can reconnect. And I think it's important, Jorge talked about how the negative, if the family was negative towards the person. There have been studies that show that even if a family is neutral, the mental health issues for LGBTQIA youth go way down to single digits, go way down. So it's not even that family has to be well informed and that they have to be totally supportive. It's just that they stop being negative. So we're moving on to the preferred terms. And in the olden days, we used to hear things like homosexual, homo, fag, faggot, dyke, transgender, tranny, cross-dresser, transvestite. And this is an educational session, so we're pointing it out to remind you of the words, of the negative words. And if you didn't know it, we want to point out that they are negative words. So sexual preference, like I've decided this, it wasn't innate in me. Gay lifestyle, because we all have the same lifestyle and it's fabulous and it's not for everybody. And that we have a same-sex attraction. Well, that again indicates that we have control, real control over the person we are sexually attracted to, which isn't necessarily the case. So if you are interpreting in English, the terms that are preferable would be gay for gay men. Sometimes it's also used for gay women or lesbians. Lesbian obviously is for women. And then bisexual means that an individual feels that they're not necessarily equally attracted, but attracted to both men and women for their sexual pleasure. Transgendered, or oftentimes referred to just as trans, is someone who was born with an outside body that's different than the inside body. So transgender or trans, not tranny, cross-dresser, transvestite, those are different, and those are really negative terms. So transgender is the preferred term. Sexual orientation, it's not a preference. It is how we were born, just like many of you were born as being attracted to the other sex. When we got to puberty, and perhaps before that, we knew that we were different, and we might not have been sure of what that was, but eventually figured it out. And we understood that our sexual orientation was different, was for the same sex rather than the opposite sex. Gender identity or gender expression, again, how we feel about who we are. A relationship or couple, not a homosexual relationship or a homosexual wedding. It's not even a gay wedding, right? It's a wedding. It's a couple. And sex is sex, whether you do it with men or women or man and woman does it. So just sex in general. Sexual alignment or gender affirmation surgery is a term that's being used now. I know it was very common in the past to use sexual reassignment, even among people who knew about queer things. But sex change and sexual reassignment are not used anymore, and sexual alignment, aligning the inside and the outside of one's body. Gender affirmation is really what the term is that is used now. And transition is still used, but less so. Someone is assigned or designated male or female at birth, and that's different than biologically male or female. That has a bit of a negative term. It was assigned, but especially for a trans person, this is an important designation. And then a lot of people you will see in the news sometimes, especially on certain websites or in certain publications, they want special rights. Well, us queer folk only want equal rights. We want to be able to rent apartments, buy condos, etc., just like everybody else. We want to be able to buy wedding cakes like everybody else. We want to go on vacation and have them recognize us and our marriages or our partners the same as they would for anyone else.
And then there's other.
Go ahead.
No, sorry. There's as Tim was going to say, there's some great guides also available on the website to help you with these preferred terms, because even for us, sometimes we're not using the right terms, and so it's always a real education to be up to speed on what is most acceptable as we progress. So other linguistic issues that are going to come up, there's going to be issues regarding pronouns. We already talked about the issues between different types of relationship statuses, whether somebody refers to their partner, as a husband, as a wife, as a lover. As we all know, as interpreters, words matter, and words can have a real impact. And so it's important that we be prepared as interpreters, that we go into these scenarios already having a bank of terminology in the target language that we have at the ready to use if and when we encounter somebody who's saying, I'm in a domestic partnership, right? And that we're not going to call that a marriage, because for whatever reason, that person chooses to describe their relationship as a domestic partnership.
I think this slide also, it's helpful to talk about things like Latinx. In California, and I know not everybody is from California who's on the call, but in California, there are many, many, many Latinos. And it's started to become very popular for people to use Latinx. And for anyone who knows Spanish, but it also is the same for other languages, if there are 99 women in a room, you use the female pronoun. If one male comes into the room, suddenly the pronoun becomes, according to grammatical structures, becomes masculine. So all of the women are kind of negated. And so a lot of times now you will see people using Latinx so that you don't have to make that determination, which is great. I'm all for it. But as an interpreter, how do you interpret that? Right? So think about that challenge. Another is, and Jorge has it on the slide here, they and them. We have a transgender individual at our hospital who wants us to use the pronoun. It's an individual, but wants us to use the pronoun of they. Typically in English, they would mean more than one person. He, she, she, etc. But this individual strongly feels that they want to use the pronoun they. So as an interpreter, how would you interpret that into Spanish? It sounds simple, and it may be for you, but it can also be confusing because there's only one person in the room that you're interpreting for, right? So think about some of these issues as well. When we're talking about interpreting, and we talk about this for lots of different things, as an interpreter, we're supposed to always understand that our role is to interpret. We can bring in cultural information that will be helpful for the provider. We can also bring in medical information after explaining what we're going to do to the provider, to the patient who may not clearly understand how our medical system works. And it would be best if the physician or nurse practitioner would do it. But in some cases, we're called to help connect the dots, right? With regard to LGBTQIA issues, there are lots of things that impact one's feeling and one's ability to interpret for someone who's LGBTQIA. So religious affiliation, there is absolutely not a 100% correlation between if I am Christian, then I'm anti-gay, right? Or if I'm Baptist, I'm anti-gay. Or if I'm Jewish, I'm pro-gay, pro-queer. But religious affiliation can have a big impact on the information that one receives, the type of information. It may be more biased than factual. And so religious affiliation tends to be one of the things that impacts an interpreter's ability to interpret for LGBTQIA folks positively or negatively. Another is political affiliation, and sometimes religious affiliation and political affiliation are closely tied and have a similar effect. Sometimes they're not at all. But one's political affiliation here in the US or perhaps in your home country may also have an impact on how you understand what you understand about the LGBTQIA communities and how you can interpret for them. And similarly, similar to the religious affiliation, you may be getting a lot of information, but it may or may not be factual. So it's important for an interpreter to look outside of what their political group is telling them at other newspapers, magazines, websites, and so forth that may have differing opinions about things so that you can form your own opinion so that you understand better when you go into an interpreting session. Country of origin. This impacts both the patient and perhaps you as an interpreter. You, if you were born in the United States, you may have no conception about what someone who is LGBTQIA may be feeling, have experienced, etc. in their home country, and now they're in the U.S. as a refugee, and you may not understand why they're being resistant to what the questions being asked, or, oh my gosh, why would they ask that? I couldn't possibly answer that question because I could be jailed for that, right? So country of origin is a big thing. And as we talked about earlier, if someone is in a country, and let's talk about, for instance, Russia, Chechnya, that had a thriving LGBTQIA community in the past, but much more recently, people are being killed, people are being jailed, you can't demonstrate, you're being set up, and so they're going to be very hesitant to talking about anything from their home country. Urban versus rural, this is a huge thing, and this is with regard to the United States as well as with regard to other countries. If someone grew up in a big city, they tend to have more information. Obviously, again, not 100%, but they tend to have more information, be a little more knowledgeable, and have more exposure to people from other cultures and the LGBTQIA community. People in rural areas, they still have access. In the United States and many other countries now, the internet is an awesome thing, especially for queer kids and queer teens who don't understand what's different about them, but they're trying to figure it out. And we didn't used to be able to get information as easily as we do now. So rural people have access, but it's not nearly as easy to get information as it is in the urban settings. Coming out. This is something that Jorge and I have had discussions about. Many LGBTQIA people think that it's important to come out, to kind of take a stand and say, hey, everybody, I'm gay, I'm lesbian, I'm bisexual, I'm transgender, I'm intersex, I'm asexual. And you may think that that's weird, but if you're going into a relationship with someone, it's important for them to understand where you stand. But others don't feel that it's an important thing at all, that it's part of who they are, and someone will find out as time goes on. But it's not something they feel they have to do. And many people on the outside feel that coming out happens once, when in fact it happens really throughout someone's life. And not only for the LGBTQIA person, but also for their family members and friends. So if I'm moving to a new city, I'm starting a new job, I have to disclose, I don't have to, I suppose, but if you're trying to get insurance for your spouse or for your children, you're divorced from a same-sex couple, but you need to get insurance for your child, there may be information that needs to be shared that would out you. So that's important to think about as well. Patients who come to us may not be willing to come out, especially during the first few sessions, but maybe eventually, if they understand that the interpreter isn't frowning, isn't making faces, isn't using negative terminology, and neither is the provider, that would provide them with an environment in which they feel that they could be comfortable and they could share that information that before they didn't feel like they could. And then we have hetero and or cis normativity. So I am a male, a gay male, but I feel like I'm a male. I was born into a male's body. I don't feel like I was born into the wrong sex in terms of physical body. So there are a lot of things that, like Jorge, went to a beautiful hotel in a fabulous place, and it said Mr. and Mrs., right? That's not the standard anymore. There are a lot of LGBTQIA folks, and we need to be a little more sensitive to that.
All right. So, sensitive health topics.
About 10 minutes, Jorge?
Yep, we're good. So there is not only are you going to encounter new vocabulary that you haven't encountered before, not only are you going to be put in situations where you as an interpreter need to reflect on your own biases and your own feelings about topics that are different to you, but you're also going to be exposed to different types of health issues that you haven't seen before. You're more than likely, you're going to be involved in more in-depth conversations that involve sexual scenarios that may be uncomfortable for you as the interpreter. In discussing sexual alignment surgery, that's not just one surgery that happens and all of a sudden the person is now a trans man or a trans woman. There's breast augmentation, facial feminization, labioplasty, hysterectomies, mastectomies, scrotoplasty, hormones, a lot of medical terminology, that you'll be exposed to. And one of the things that was the most eye-opening for me as we were preparing for this presentation was a glossary that I found on intersexuality. So women who don't have ovaries, men who don't have testes, women who have no clitoris, people who are really scarred because they remember having multiple surgeries during childhood. And so having mental health discussions in relation to that, you see a higher prevalence of that when you're interpreting for a person that is intersex. So this is a really great list. We've got again, going back to the ncihc.org/LGBTQIA, we've got some great resources available for you to be able to study and prepare yourselves and really kind of open your eyes as to what some of these different may be that you'll be having with patients who are sexual and gender minorities.
So, as an interpreter, we have a big responsibility. We're supposed to relay information in the way that a patient or a provider has expressed it. We need to be accurate. We need to ensure that confidentiality is kept. We need to be impartial, and impartial means a lot of different things. And impartial can mean that I don't make facial expressions, negative facial expressions when I'm interpreting, even if my words are neutral, right? That's not showing impartiality. We need to be respectful. We need to respect. Cultural awareness. So this is one more culture that you're learning about today. And it goes in line with the cultures of where someone may be from originally. Or it may be that someone was born here, but they're born into the Russian community, or they're born into the Spanish-speaking community, or the Polish-speaking community. And what does that mean for them? What does that mean for you as an interpreter who's interpreting for them? Really important to be aware of the LGBTQIA culture and how it interacts and intersects with both English and your other target language. What are our role boundaries? If we're very religious, do we say, well, we'll pray for you after the session? Of course not. It's not professional, but it's also not minding our role boundaries. We're also not there to educate the providers, right? The providers have the responsibility to educate themselves, so we shouldn't take on that role. But as interpreters, we can help the provider understand, well, in his home country, this is what has been going on. This is what he expressed in other sessions that I think would be important for you to know about. And if it's something general, it may be okay to do it in front of the patient, but otherwise it may be something that you need to ask the provider to step out about so that you can speak in private. This is part of your professional development. Thank you for participating today. It's an important topic. People have been discussing it, but kind of on a topical level, it's really, and having been kind of studying this for a long time, as an interpreter, there's so much information that most interpreters don't have about this topic that would really benefit them. And then advocacy. Obviously, if someone's physical health or if someone is being treated inappropriately by a provider, you as an interpreter have the ability, and it's part of your standards, to raise the issues either to the provider if it's appropriate, to their boss, or whatever mechanism that you have in the facility that you work for or the agency that you work for to help someone understand that the way that they interacted with that person was really not appropriate.
All right, so we're going to be wrapping up here in a minute. So if you have questions, I think there's an opportunity in the chat function to enter your questions. But on the screen now, you should see a list of additional resources. All of these links are available on the ncic.org/LGBTQIA page. These are national organizations that aren't really involved in the type of language access work that we are all involved in. However, they have a tremendous amount of resources available on their websites, webinars that you can take, presentations, vocabulary, you name it. A lot of them have translated health information on their websites. So it's a great reference tool for the
Jorge? Jorge? I guess he's disconnected again, so I'll pick it up again. Okay, so great resources. Please take advantage of them. There's tons of information for you. We also think it's important for you to understand that there are local community resources. While there are national ones that are important, there are also typically local resources. It may be just within the state, but it may also be in your local community. And many of them, to be honest with you, are struggling nonprofits that really may not have a lot of funding. So they may deal with English speakers specifically. Perhaps this would be a way for you to gain more experience. Perhaps you could contact them and see if offline you could work with a patient who really needs help and really needs help by going to one of these organizations and volunteering your experience as a trained and professional interpreter, because we know when other people act as interpreters, it really generally does not have the same impact with patients or providers, that it just doesn't work out as well as when we have someone who knows their boundaries, who knows language and terminology the way that we know it. And it's also important to have suicide hotlines, especially for LGBTQIA folks, where we know that the youth in particular, but it's not limited to the youth, will have oftentimes suicide attempts because of the negative information that they're getting and feelings that they're getting from their family, from the community, from their church. If people were just at least neutral, suicides would drop precipitously in the LGBTQIA community. One other thing I wanted to mention is there's a lot of vocabulary that we've gone over very quickly, and on the NCIHC website there are glossaries that have other language equivalents on them. So please, even if you go for nothing else, and we hope you go for lots of things, and we hope you're all members of not only CHIA, which is very important, but also NCIHC. But you can go to this website that's on the bottom of several of the pages, and there's lots of free information, and frankly, you don't have to be a member to go to the website that's listed on the website, the NCIHC website on the bottom of some of these pages, ncic.org/LGBTQIA, and you will get the treasure trove of information that we have linked from this presentation. So we are now available for questions and answers if there are any already out there. Otherwise, feel free to type them in now. Otherwise, Jorge and I have no problem filling up the time.
Thank you, Tim and Jorge. This has been a lot of information, and so we do have some questions here, and the first question was related to the terminology cisnormativity. If you could review what that meant.
Yeah, so cisnormativity, okay, so heteronormativity is the assumption that everybody is straight and only the outsiders are gay, right? So it's living in a world that's made for people who are heterosexual and always having to acclimate to that world. Cisgender is somebody whose gender identity and gender expression conforms with their sex. So I was born with a penis. I feel like a man. I express myself as a man, and so that I am a cisgender man. So cisnormativity then is the world that trans people have to live in. It's a world where everybody's gender identity and gender expression, most people's, conforms with their sex. And so it's always having to, really explain yourself whenever you're living in that world, because you are the other. The trans person is the other. They are the abnormal one.
Very good. Thank you for that. And I think then the next question, and we can sort of segue into this next question then, which is how should an interpreter address a situation or handle a situation in which the provider is addressing the patient's assigned gender instead of their identified gender? Should the interpreter edit the message in any way, or how should that be handled?
So from my perspective, it would be, and this is not an easy issue, but it would be an advocacy role, right? Because someone is being treated disrespectfully from our perspective if we know about the topic. And so I would take an opportunity to briefly speak to the provider about the patient identifies as female, the patient uses the name Maria instead of Juan, right? So to take that opportunity, and from my perspective, that is absolutely part of advocacy. I think one of the challenges comes in around the enormity of a healthcare system where there are so many people with access, and a lot of the electronic medical records are much less forgiving with regard to preferred name and pronoun until someone legally changes their name. And hospitals and doctors' offices and so forth have to continue to use the legal name when billing, even if they're requesting and want to use a preferred name. So both names are still in the file, and people may get confused about it. But as an interpreter in the immediate situation with the provider, I would advocate be respectful, but let the provider know that this is what the patient has expressed.
And on that note,
if I could add something.
Please.
Go ahead, Michelle. Yeah, so the one thing I wanted to add is that I think it's really important that we not make assumptions, right? So if you have this kind of conflict between what you perceive the patient to want and what the provider is saying, I would start by pausing, asking the provider to give me a moment to clarify with the patient, and then clarifying with the patient. The provider is using male or female or whatever pronouns. Do you feel comfortable with this? Do you want to continue that way? Or would you prefer that we use those other pronouns? And I think that too kind of changes the conversation a little bit when you then have that conversation with the provider and say, I've consulted with the patient and this is what the patient would prefer.
Very good. Good advice.
And I would just follow up on that, saying that the interpreter, and I don't disagree at all with what Jorge said, but in a hospital setting or in a mental health setting, typically you're going to meet the patient at registration. And so you will have already heard that information and already be aware of it. So if it was passed inappropriately to the provider or he or she didn't really look at the notes as they should have, you have the opportunity to clarify then because it's already been clarified by the patient.
Can you give us an idea of how healthcare providers are being trained on the LGBTQIA issues?
Yeah, well, so
go ahead.
While Tim's thinking about his answer, because Tim actually works for a healthcare organization, so I'd actually love to hear what his organization is doing. But one of the things that was really eye-opening to me this last time that we were in Portland, Maine for the NCIHC annual membership meeting, and it was amazing to me. So there was one healthcare organization, actually, if I'm not mistaken, out of California, but they actually have mandatory training, very similar to cultural competence training, but mandatory training for every single employee of that healthcare organization that they have to go through around this topic. So more and more, we're seeing healthcare organizations really step up. And in fact, the Human Rights Campaign has an annual report where they share information about organizations and the work that they're doing to address these issues, and more importantly, to educate their staff on how to appropriately handle issues that are new to them. And a lot of that too, one thing is that behavior, right, amongst the healthcare providers and amongst the staff, but the other piece is also the infrastructure. So as Tim was mentioning earlier, making sure that forms are updated, that medical records have varying gender categories to be chosen from, that the options are not only male or female. Things like that, healthcare organizations are really starting to step up to the plate and make those adjustments to ensure that they have a more welcoming environment for patients.
I think, we have a diversity training that all staff have to take, and LGBTQIA issues are mentioned in it, but not nearly to the depth that is as useful as it could be. I don't think medical schools are doing as much as we would like. I think it may be kind of, again, similar to, oh, well, this is a diversity topic and we'll spend, a half an hour on it or something like that. So I'd like to say that it was being discussed all the time and that it's very commonplace, but I don't think it is. And I think that's really dangerous. I think one of the issues that has come up with us, and we've now had an electronic medical record for over 10 years, is thinking about someone's, especially for trans people, but it's also true for gays and lesbians as well. But if you think about a trans person, physically, they have certain parts of their bodies that are never going to change. Even if they get surgery, there are certain internal parts of their bodies that are probably never going to change. If a woman has a breast reduction because she's a trans male, that person still needs to be tested and get mammographies during the course of her adult life. If it's a male physically and they still have testes and so forth, you have to be tested for male issues that may come up later in life. And one of the challenges is, while they have in the electronic medical records and in the old paper records as well, lists of, okay, if somebody's a male and they're this old, they should be tested for these things. If someone is a female and they're this old, they should be tested for these things. What they don't have, at least many of the electronic medical records don't have well built, is a trigger. So someone's name is Maria, and she has been living as Maria for many years, but she was born a male. And so there are certain tests that should happen automatically later on in life to make sure that she's not going to get cancer of some sort of other that is more likely to happen to someone who was born in a male's body. And similarly, someone who was born in a female body and who may have his uterus for the rest of his life, well, that needs to be checked out as time goes on. And right now, there are not a lot of automatic systems that make that happen. And sometimes providers are not well trained to remember and to check the list for, the born as gender to be able to do some of these tests that they should be doing.
Good. Thank you. Those are a lot of provide a lot of thought. I think it's one of those answers that provides more questions. So I'm going to go back to our attendees' questions here, which very simply. We've got somebody asking, he's from a country, a large metropolitan area, but says, it's still difficult for people from the LGBTQIA community, in his country where he's coming from. So as he's interpreting for them here in the U.S., what can he do? What is the approach that can help patients to feel more comfortable and to have less fear when they're in the healthcare setting?
For me, as a CMI certified medical interpreter and a CCHI interpreter, I would say that it's being a good interpreter, right? Reminding them about confidentiality. And if you really truly feel, or for a fact that someone is LGBTQIA because that you can do the reminder at the beginning. In hospitals, oftentimes the interpreters, as much as we say they should, don't do the full introduction because providers are already talking to the patients, right? But to have a reminder that everything you say will be kept within the treatment team. And make sure, again, that facial expressions, that correct terms and not negative terms are used when interpreting back from the doctor. That can make a huge difference, that they're being treated with respect. And it's probably not going to happen right away, but over time, generally, I think people will feel more comfortable and understand that they can speak about these issues and how important it is. And if you truly felt that also, you could kind of forewarn the provider and just say, I believe for various reasons that this person may be LGBTQIA. So if you had not planned about asking anything about that, perhaps you could ask some generic questions. And again, it may not be the first time they may say, no, 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 no. But over time, they may build a relationship with the provider, knowing that you as an interpreter is not going to share any information outside.
I think that aspect of confidentiality is highly important, especially as you indicated that some people may choose to come out and others may not, and you may not know. It's not our job as an interpreter to determine when and where that happens for another person. So always that confidentiality is very important. You have to remember in how you address people and remember, going back to the NCIHC Code of Ethics and Standards of Practice. If you're not familiar with those, I encourage everybody to take a look. And CHIA also has a Code of Ethics, but making sure that you take a look at those and are very familiar with how to handle issues related to seeing patients outside of the healthcare setting and helping to maintain their confidentiality. So with that, we're toward the end of our session here, and if there are any questions, I believe we got to most of the questions. If there are any other questions, though, I will be sure to pass those along to our presenters so they will have the opportunity to answer those offline. Unfortunately, we can't always get to every question during the webinar, but we try our best to pass those questions along so that they can be answered at some point. And gentlemen, I don't see contact information here for you. Would you like to let people know if they do have questions, if they're able to email you after the fact, or what would your preference be?
Certainly, we're happy to have them contact us. Email for me is tim@baystatehealth.org.
And I can be reached at jorgeungo@gmail.com. So it's my first and last name with no hyphen and no period @gmail.com. You can also reach out to me on LinkedIn, on Twitter. I'm at Jorge Ungo, and also active on Facebook.
Great.
He's so popular.
Super. Thank you so much. Thank you so much. Appreciate that. And so I want to just remind everybody that Certificates will be emailed out to you within about a month, typically within a couple of weeks, but certainly within a month of today's training. So you don't need to do anything further to get that certificate, unless after a month you find that you haven't gotten it. Check your junk mail folder, and if you still don't have anything, do get in touch with us at info@chiaonline.org. Remember that we have our upcoming trainings the second Thursday of every month, except March, which is when we hold our annual conference, but the second Thursday of every month at this same time from 9 to 10:30 Pacific. We will have our webinars. We've got about 3 or 4 of the future topics already listed on the CHIA website, chiaonline.org. And again, we will be posting the recording of this webinar to the CHIA YouTube channel. Note that there are 2 CHIA YouTube channels. There's an old one and a new one. So you want to go to the one that says CHIA New, and you will see the webinar recordings and have an opportunity to review some of this great information that has been presented by Tim and Jorge today. And again, we encourage you to subscribe to the CHIA YouTube channel and to follow us on Facebook, and that way you will be updated when those recordings are available, as well as on any of our online or on-site trainings that will be happening in the future. We're going to shut this down in a moment, and attendees will have an opportunity to take the survey to give us your feedback. But I can tell you, gentlemen, that we have had already a number of compliments come through on the chat screens about the quality and the content of the information that you've presented. And I know that on behalf of myself and the rest of the CHIA board, we greatly thank you for your time and your efforts in this area, and hope to have you back to hopefully do some follow-up on this conversation, because I know we've just barely touched the surface, and there's a lot more to discuss, and that the issues are evolving, and that we need to stay up on those as well. So thank you so much. We really appreciate having you today.
Pleasure.
Thanks for having us.